Hello, I'm Dr. Valerie Walker, and welcome to part 2 of what we're talking about, neuropathy. If your doctor ever told you you had neuropathy, just to recap real quick from the other show, we learned that the brain and the spinal cord, nothing but big bundles of nerve fibers, and all the 7 trillion nerves that originate throughout the human body actually originated from the brain and the spinal cord. So that's a lot of nerves. So somebody again tell you got on your nerves, you got on a lot of people's nerves. Okay, so where we're going to pick up from before is just mononeuropathy. Mono meaning one. And mono, what that means again is just one nerve is involved. And one of the typical and biggest examples you'll see of that. Have you ever heard anybody say they had carpal tunnel syndrome, that they went to the doctor and the doctor told them because they was having numbness and tingling in their hand? And actually you could have a lot of pain in your neck, because a lot of times if you got osteoarthritis in your neck or degenerative disc disease in your neck, it can radiate from your neck and all the way down your arms and all the way down into your fingers. And in your wrist you got the carpal tunnel, where a nerve called the medial nerve rolls through it. And whenever that nerve gets compressed, and that's a form of carpal tunnel syndrome, is when you pressing that nerve down, of neuropathy, then you can have all that numbness and tingling. And a lot of times you have to go to physical therapy, you have to wear a brace. If it's really, really severe, you have to get surgery. This comes from a lot of repetitive action. So all our workers who work on computers all day long, bent at that wrist, you can compress that nerve, and that's called a compression neuropathy. And we see that a lot in this country, and a lot of people have to go out on workman's compensation or sometimes even long-term disability, especially if it affects both wrists, meaning you can't do all your data entry, which is the bulk of jobs we see today. People are sitting at computers all day long, and we call this repetitive motion syndrome, when you're just sitting there all day just typing. So I always tell my patients, get up, stretch, take a break every 20 minutes and stretch those hands and that wrist out. And if you have to wear like a brace, then do that too, because that is the form of neuropathy. It's carpal tunnel syndrome. And then you can have what we call a mononeuritis, or polyneuropathy, because that means, again, that nerves all over the body are in trouble. And there again, we see the bulk of that with diabetics, because they can get in trouble with their organs, and that would be that autonomic system. Remember I told you SAM for the sensory, A for the autonomic, and M for the motory. Well, in the autonomic system, because you don't control it, if those nerves are damaged that say innervating your stomach, then you can have problems with your stomach, because you have a sick nerve trying to supply your stomach. So always remember, it always depends on how many nerves involved and where they're located, the symptoms you're going to feel. That's why the symptoms can just be all over the place, because you don't know what nerve of these 7 trillion that we're talking about that's giving you the problem. So they could be all over the place. Now, some of the symptoms you can feel is painful cramps, especially in your hands and in your feet. Fine motor twitching, meaning the little fingers and hands could just twitch, or you find yourself just kind of rubbing your hands and your fingers, almost like you're trying to bring the feeling back in. You ever set up in church a long time, or set anywhere, a concert, a meeting or whatever, and you cross your legs for such a long time, and then when they tell you it's time for you to go on a break and you go to stand up, you wobbly and you can hardly stand up, and you got to stand there and let the quote-unquote feelings come back in. That's a form of compression neuropathy, where you've pinched off that nerve so long. Or you can get a crook in your neck and sleep crazy. I call it sleeping crazy, with your neck twisted all funny and pinch those nerves off, and that's a form of a neuropathy. A lot of times, most of those, like I said, may not be so severe. They can be temporary, but when they're chronic and ongoing, then that's when we have a problem. You could actually have muscle loss. A lot of times if you look at people and they got what I call pot belly and chicken legs and losing all that muscle in their legs and stuff, then that can be due to a neuropathy and a lot of times diabetes. You can have problems with your hair, skin, and nails because they, again, with the nerves that supply your hair follicles and all, if they get damaged, guess what? The hair follicle gonna get damaged too. And guess what? You can have some hair loss. And all that inflammation that goes along with neuropathy actually can contribute to those follicles getting ill. So a sick nerve can equal to a sick body. That's what you need to be to carry on from here. And all that numbness and tingling in your feet and all, that's very distressing. Most of the patients tell me that's what distressed them the most, is that numbness and tingling, and that we could just do something with that. And the autonomic side, depending again on the organ or gland that's involved, those are the symptoms we see. You can have urinary incontinence, and guess what? That can be from a neuropathy because the nerves that supply the bladder may be acting up and acting bad. So then you're having problems voiding on yourself or getting up late at night, running to the bathroom 100 times, or can't control your bladder. So those are all the things that we can see in that auto side of it. Like I said, it's automatic. Autonomic side, you have nothing to do with it. You just can't tell the bladder, I don't want to go urinate right now. Well, guess what? It's going to be all over your clothes because you cannot direct the human body like that. Now, sensory neuropathies, again, can give you sensitivity to temperature. I've had patients so sensitive that have a sensory neuropathy. If I go to touch them, they jump. You mean things like light touch they can't even handle. And they'll go, I said, that hurt? And they go, oh yeah, Dr. Walker, especially if they have a lot of degeneration in their neck and all those nerves up there are damaged. You go to touch them just slightly during the physical exam and they almost come off the table. So you have to leave that alone too. And in the motor neuropathy, we mostly looking for things like impaired balance. You cannot balance yourself. The coordination is off and you have very weak muscles. Those muscles start getting weak. So part of the treatment is going to be by you making sure you keep your muscles nice and strong at all times. Now, the process involved in it is, number one, in getting those nerves damaged, is a lot of times inflammation. I said years and years ago, before anybody was listening to me, I said, I think the whole human body is inflamed. Meaning it's like a furnace going on in there, just inflammation. So everything we see now is inflammation. Whenever you see inflammation, there's always itis, like neuritis. That's an inflammation in the nerves. And we see that a lot of times with chemotherapy and radiation. So itises, I call them all the itises, can give you a neuropathy. That's one of the processes. The other process is that compression process, and I just talked about that, so we won't go into that anymore. That's like with carpal tunnel syndrome, where that medial nerve going through that carpal tunnel is pressed down. So anything that pressed down on the nerve can give you a lot of problems. And a lot of it is associated with things when people say they got sciatica. You ever heard some people say, oh, the doctor said I got sciatica? A lot of time that nerve can get compressed, and trust me, when you compress that sciatica nerve, you got a problem because it hurts. It hurts through your butt, down your leg, and I have patients say it hurt all the way down into their toes. So that's a big problem too. Chemotherapy, again, that's a form process that can damage the nerves because a lot of these medicines we use in chemo is pretty strong. And the biggest of all is always going to be, and we're going to always come back until we get a cure, is diabetes. That's one of the processes. So how do we treat it? Let's get into treatment. The treatment is, number one, you got to eliminate the cause. You got to find out what's causing the neuropathy. You just can't be shooting in the dark. If you can find out what's causing neuropathy and try to control it, then we're in better shape. Like say, even with Ramsay syndrome, if you can, Bell's palsy, if you could hit a person real quick with some steroids, their outcome will come out much, much better. So what we're trying to do is maintain in our treatment your physical strength and your muscle strength. Those are the two things that we do not want to see go when you have these types of problems. So what we want to do is rule out, first of all, when you go see your doctor and you tell them things like I'm having numbness and painness in my feet, Everything is a diagnosis of exclusion, meaning we got to exclude stuff, exclude stuff. So even in neuropathy, we have to exclude stuff. So a lot of times the doctors will want to do a CAT scan or a brain scan to make sure nothing is going on in that brain. Because remember I told you that brain directs it all. It's that big computer that's just sitting up in your head that's directed all the traffic through the spinal cord to all parts of the body. So they'll want to do that. Then they want to do some labs on you to make sure nothing is going wrong with your labs. They'll do a complete laboratory work on you, check your thyroid, check your glucose, your liver function, your kidney function, check all that stuff just to make sure they're not missing anything. They'll check a lot of times your vitamin levels too, because I know vitamin D deficiency a lot of times can make patients feel fatigue, and they also tell me they have a lot of heaviness and pain in their legs. So they're going to check all these things on you to make sure nothing is going wrong. And then an electromyography is a good thing where we check nerve function and the nerve conduction study. A lot of patients think it may be a little bit disconfident, but you have to have these tests done to help your doctor provide you with the best treatment. So having said all that, we're going to do labs, we're going to do a physical, nerve conduction study, and all this. Let's just talk about real briefly how we would treat it. First of all, after we've identified the cause, if we can, because if you were paying attention, and I hope most of you were, you heard me say that a lot of times we don't even know what causes neuropathy. But if we find out the cause, the first thing we're going to try to do is get it under control. Like diabetics, we got to get that hemoglobin A1C normal. We got to get you eating right. We got to get you off all those sodas and things that we know will aggravate neuropathy. You'll notice if diabetics notice when they drink a soda, their neuropathy gets worse because sodas are mostly sugar. So you're just giving it the sugar, which is messing up those 7 trillion nerves that we've just been talking about. Then we have medications that actually treat neuropathy. Now, antidepressants we use. Sometimes doctors will use a medicine that's indicated for one thing, but we'll use it for something else. Like Tylenol is indicated for a fever, but we also use Tylenol for pain. So we can use medicines that don't have the label for it, but if it helps and the benefits outweigh the risk, then we can do that. Anti-epileptic medications. You've heard of gabapentin and all those types of drugs. We can also use those to treat neuropathy. Opioid meds, those are narcotics. That's getting pretty high. You know, and that neuropathy's got to be pretty severe for us to switch over into opioid medications. Prednisone sometimes, like I said, high dose if we catch it in the acute phase. Remember I told you it's an acute phase where it happened, boom, you just wake up one morning and something is wrong, versus chronic. It's been going on for years and years and years. Then maybe we can use some opiates if it's not that bad. Then research is being done too on capsaicin. This is what's found in hot peppers, hot chili peppers. That's why they said people that eat hot chili peppers, they don't hurt anywhere because they're getting all this capsaicin in their body. And actually they got a lot of creams out with capsaicin, and the word is not clear of whether this hurts. But I've had patients that say the main problem that they have a lot of times in their legs and all with neuropathy, that some of these creams actually hurt and they help, and they're over the counter. You don't need a prescription to get those. Guess what? THC in marijuana has been shown by some research panels to help neuropathy, and I think they're going to find a lot of things that it do. It's a weed, it grows wild, and they found a lot of medicinal purposes for it, including in the treatment of neuropathy. We're still doing research, and I'm quite sure they're going to continue to do it, and I will update you and keep you posted on that. Medicines like clonidine, we use for blood pressure, but has been implicated. And a lot of times, like I said, we don't have all the research to prove it, that it could help too. TENS units, those cutaneous electrical nerve stimulus, they've been used. We talk about acupuncture, and I would need all my chiropractors to give me a shout out and tell me what they think about acupuncture in the treatment. So we do have a treatment. You want to talk to your doctor. You want to nail down which of those 7 trillion nerves are giving you a problem, and better still, what we can do about it. One of the basic things you can do about it is try to keep a healthy diet. Always know you are what you eat. As long as you keep that diet healthy, as long as you exercise to keep those muscles nice and strong, and the biggest thing, keep stress out your life, because stress triggers everything. I will say it forever. Anything wrong with you, I can paint a picture for stress. Don't smoke and don't drink a lot. Ladies, 1 drink, men 2. I think we'll be able to help you live with neuropathy. That's our show for today. I hope you learned a whole lot and know that there are things that we can do to help you. Just go and call your doctor. I'm Dr. Valerie Walker, and thank you for watching.